5, 6. That's our 6. So, Tessie, whenever you want, we're good. Thank you very much. Good morning, everybody. So this morning, I think what we wanted to do, some of you mentioned that you got the attachment that Greg sent out, and some of you did not.
I did not.
So maybe, Greg, we could just reshare it on the screen.
I will do that. Though we should first take roll and then approve the meeting minutes from the other week from the 19th. Is that okay?
Absolutely.
Okay. So I'll take the roll. Trey Addison?
Present.
Greg Sini, present. Bonnie Berman?
Present.
I'm assuming you're waving your hand or saying present. I know you're present. Lori Stevick Rust?
Present.
Jennifer Droust?
Present.
Tina how do you spell that? Or how do you pronounce that? Hochwald? Hochwald.
Yep.
Tina Hochwald.
Present.
And then Varan Mahajan is not present. Okay, all but one. And then have you had an opportunity to read the meeting minutes? And if so, are there any corrections that are needed?
Yes, I have, and I make a motion to accept the minutes.
Can I get a second on that?
I can second.
Was that Lori?
Yeah.
Okay. All right. Okay, that's all we needed to do from that perspective. So go ahead, take it away, Lori.
Yeah, thank you for keeping us focused here, Greg, because I get all eager and just jump right in.
I know.
Everybody's present. Thank you for that. Would you mind putting the skeleton document up that you and I and Trey worked on to share with the team here that we can start taking a look at?
Sure. Now, do you want me to? So I broke it up into 3 different. So I did early detection, I did the prevention education, and then the intervention and management. So we basically have 3 different documents. Do you want me to?
So maybe let me frame it up and then we'll open up the first one. As I was, I think, mentioning a bit offline here, but one of the things that we did was to really take the working documents that we did in our pairs and then try to look at where can we find the similarities and bucket that again even further. The ultimate goal here is to start taking this data and bringing it down into a laser focused 3 to 4 buckets that we need to really look at. What are the obstacles and how will we know if we've moved the needle? Because then that way we'll be able to ask for the support that we might need to be able to create the final document in August. So with that said, we brainstormed, and obviously that's what we want to treat this morning's meeting as. This is certainly not etched in stone. But, and I mentioned, I think we all kind of come at this through a different lens. For me, looking at the crossover between each of our groups, I saw this in sort of a linear progression. So prevention, fitting into the whole health and wellness and brain health, even though we know that sort of prevention is a bit of a misnomer, but you understand the concept of what we're talking about in that bucket. And then the second being early detection. And that was part of where each of our groups looked at, what do we need to do to improve the diagnostic process? And what are the obstacles to making that early detection? And then the third bucket being interventions. How can we better be intervening? And then fourth, and we might decide that this gets rolled in again, collapsed into another one of these buckets, is end of life care. I know one of our teams really focused a lot on that component as well, which is really important. The crossover that we saw in all of our areas was education, education, training, education, education. So we tried to fold that under each of these buckets. Now, when we put the documents up there in the skeleton form, certainly if you guys look at this and think, I think we could even bucket further or distill this down even in a more tight document, that's the ultimate goal as opposed to adding. So with that said, maybe we start, I think linear, even though we know things will start, early detection and prevention gets folded into education and intervention as well. But for the purposes of this document, maybe we start with prevention and early detection.
I'm trying to figure out how to see on this screen. It's not showing the full title here. Let me, let's see. Yeah, that's prevention. Okay, good. Can you see that?
Yes.
So basically, on each one of these, we put our goals at the top and how those were broken out, and then the actual working document is below that. And this is sort of how it was broken out. So you can see that.
So our very first one here, then we put in prevention, education, brain health awareness. Again, these are all working titles. And then what are the obstacles? What are the obstacles to us achieving that? And then how will we overcome those barriers? Let me pause for a second before we get into the really taking a deep dive on this. Does anybody have thoughts on sort of the generic way that we've laid this out with prevention, early detection, intervention, and end-of-life care as another way of distilling down into tighter buckets? Any thoughts on that? Suggestions, recommendations for rearranging that? What are your thoughts?
Lori, can you hear me? It's
Yeah.
Bonnie.
Yeah.
So I'm so thrilled that we're, drilling back into brain health awareness. My question is, with step one, how do we factor in the part that Dr. Drost has helped us understand about inequities and social determinants when we say kind of that, well, it's in everybody's hands?
Yeah, I don't, again, that really was, I think that might have been part of the verbiage that Greg just put in there just to highlight, but the ultimate goal here is to look at the barriers and across all three areas. And we clearly know clinically that the social determinants play a role in all of this, and so I would say as we start to break this down, one of the barriers is going to be access to care, access to education. So it is a bit of a misnomer, I think, and we could certainly change that verbiage about lies in their hands, because we know that it really isn't just an individual issue. It's a systems issue. It's all of that. I think that was, again, just a rough, I think that, I don't want to speak for you, Greg, but I know when we were capturing it, I think that was just your quick shorthand for describing this. But if I were starting, one of the barriers would absolutely be the things that we identified in the other categories, which is access. At the highest level, do you have thoughts on focusing on prevention, brain health? Again, I'm throwing brain health in there because prevention for me is always and I'm sure that Jen might agree with this, prevention is sort of this sticky wicket. Like, you can still do everything right and develop a disease. So we don't want to present it like, follow all these rules and we're going to prevent this disease from happening. So I still struggle with the verbiage, but conceptually, how do you feel about having the early, like upstream, the brain health prevention, early diagnosis, innovative interventions, and then tagging in end-of-life care as our largest buckets? How do you feel about that?
So this is Bonnie again, and I would wonder, when I think about brain health, I think about the fact that You're absolutely right. There's the prevention or whatever word you want to use, way back. But the truth is also the brain health awareness act is important at each of those other stages also.
True.
So I have the same struggle you have.
Well, and I think, you're absolutely right, Bonnie. And I think in managing this is why everything is going to go forward and then loop back, and education cuts a swath across everything. It's really just trying to get our hands around how do we organize this data, which has been a real beast of a project, I think, because there's so much to do here. Jen, I think you had something.
So I agree. I think that those kind of, early or pre/early diagnosis, treatment, and then end of life, I think that makes sense. I wonder if a way to, instead of prevention, it's about identifying risk factors and optimizing, so, maybe if we're stuck on that word or that language around it, the identification and mitigation of risk factors. It's a lot more words than prevention, but
I like it because it's clinically more accurate. So then let me put out there one of the things that we tossed around, and for me, of looking at, instead of maybe 4 buckets, is there value in making it 3? And the risk mitigation, can we make an argument that that should be folded into early diagnosis as well? Because when I think about the barriers and how do we overcome those barriers, they fit right under that same bucket. But you could also make the argument of keeping them separate. Again, this is about trying to manage our data and how we're going to move the needle here. So I put that out there as a possibility that I might make a suggestion that we think about doing as well.
From a public health standpoint, I think that the way upstream and identifying individual but also population-based risk factors and what can be done to address those, I think is key to moving the needle on dementia care in general. So I think keeping them in the 4 buckets, pre-diagnosis, early diagnosis, treatment options, and end of life, I think makes sense.
Okay, great. Anybody else have thoughts on the buckets and how we are approaching this?
I would not get rid of that bucket, no. I agree with Jen.
Okay. Okay. So if we all are in agreement with the buckets, then one of the things... Can
you repeat those? You said there's 4 buckets?
So the first one would really be, instead of using the term prevention, which, I know we talked about, that language, I think, makes sense on for many other areas, but clinically, I think, is a sticky wicket. Jen, do you want to describe or label that bucket? I think the way that you put that was great.
I just said risk factor identification and mitigation.
And maybe under that, or maybe even as the pre-category where you put in pre-diagnosis, and then maybe the rest. So maybe it's pre-diagnosis, Greg, and then
just risk mitigation, I think, makes sense.
Okay, so pre-diagnosis, risk mitigation would be our first bucket.
Okay.
And then if you could advance to the next one, which I think is our early detection.
Sure.
And on that one, we'll make note to change the step 1 verbiage.
Yeah. I'm noting all that. I'll go in and update all this stuff. So I'm taking notes of all that.
Okay.
Okay.
Hey, Lori, this is Bonnie again, and I think the steps are absolutely wonderful. My question is the measures of success, in that this is going to take a long time, and I'm wondering if we're interested all in measures of progress too, as opposed, I don't know what success actually means.
Yeah, I agree with you. I think we have to change that verbiage as well. And in the original document, it was measures of impact. And that language is what I put in the original because it mirrored what the state is doing. Because remember, ultimately, the way this was laid out, again, at least in my head, was we do our 3 buckets, And then they get dovetailed in, because we're tasked also to integrate this into the state's plan. And the state's plan actually has a category that is described as impact.
Thank you.
Mm-hmm.
So do we keep the bucket as early detection?
Yes. So, yeah. So it would be the pre-diagnosis, mitigating risks is the categories, is the verbiage for the first bucket. And we'll change the word success to measure. And then we can play with step 1 and get rid of the lies in their hands verbiage, which.
Yeah, right. We'll get rid of that.
Yeah. So if you could go back to the second.
You want to go to the first or the?
Well, let's go to the next one, which should be the early detection.
Yeah. This is early detection that we have up.
Okay, then we need to play with that, because that needs to be, and we can work offline on that. But the next one really would be early detection, and then looking at those barriers. And that's the one I think we kept seeing across all different areas, was the common theme of better education, better training, primary care docs, family members, patient awareness. So all of those indicators fall under, some of those are the barriers, and then we'll know that we have impact if we are better training and educating family that then come to a doctor's office sooner, doctors who are then able to pick up on and do the diagnostic workup early on, particularly in a general care practice. All of those I see as how that second bucket might unfold with, here are the obstacles, and here's how we'll know if we're making an impact.
Yeah, the only thing I would add to that is probably some sort of health, like a health systems component, knowing that so many health systems are prevalent in the primary care space now and acquiring practices, and even just as a first line of defense from the standpoint of folks entering into a health system through whatever channel, should probably include them in that process. There's a lot of work being done around health systems across the country. So,
are you saying help as in HELP?
Health.
Health.
Healthcare systems.
Health.
Yeah, I agree, Trey. I think that's exactly where, when we look at how are we going to move the needle, that's about putting in training protocols, I think.
Yep.
I mean, I know I'm down the road here, but if I look at how I imagine this shaping up based on, where we have to ultimately be able to report out in August, it's going to be for those kinds of interventions.
Absolutely.
And every single one of our groups, as you guys looked at the work that you did with your team, as I said early on, training and education, it cuts a swath through all of that, because we can't, that really is absolutely a barrier. We're not doing enough of that. So.
Yep. Hey, Lori, can I ask you, as one of the chairs, of the extent of our responsibility here? So, for example, are we, or is it going to be the consultant that will need or should provide the research that shows why this makes sense, or what backs up our measures of impact, for example?
Yeah, I from my perspective, and certainly open to everybody else's thoughts on that, the way that I imagine us being able to go forth and say, here's what we need. As of today, I don't even know if we would be able as a committee to say, here's where we need support. Obviously, we need, a consultant who's going to help drive data. I know Trey has access to a lot of data, so it would be farming that out. But for me, and maybe the rest of you have differing thoughts on that, I don't know until we create this document and we look at, here's what we think this looks like. And in order for us to answer these questions, here's what we need. And part of that is certainly going to be access to data, a mining of the data, a summary of the data, looking across states, as Trey has mentioned earlier. But I don't know if unless we do this work, how we'd be able to go back to the larger team and tell them what we actually need from the consultant.
Oh, I completely agree. I just wondered if, as we're filling this in, are we each responsible for giving the research that backs up what we say?
No, I think one of the things to that point is a note that's going to happen is the broader task force will be briefed on just an overall or overarching where the data and where the research is going. That probably will be for everybody. I think specific committees, some committees have already started to make outreach to the association to get and capture certain data points. The one thing that we're looking at and that we kind of propose back to them is sort of what we're doing here, so that as they think through where they want to go, we can present the data around where they're thinking. Whereas if we just do just a research data dump, everybody's going to get lost in all of that, and then no one accomplishes anything. So we're kind of monitoring that. I do know from a broader standpoint, to the director's point in the last overall meeting with everybody, they do want to sort of conduct this briefing, and we're putting that stuff together to propose back to ODA to bring that research to bear. That'll be much broader, but I think, Bonnie, to your point, as we kind of look at this, if we can drill down on in these buckets, we can get the data that complements each bucket.
Perfect. So we are not individually responsible as we write something in. Perfect.
No, I agree. I mean, the beauty of doing this as a subcommittee, I think, is to be able to say, here's what we identify in these areas. I mean, if we don't, as a team, I think our job is to identify where are the barriers, and then how will we know if we've overcome those barriers. And I think that answer then comes from being able to do the reach out, ask for the data.
Perfect. Thank you.
But I think our team is responsible for continuing to take our task, our goals, and drill it down into a workable document. Does anybody else have thoughts on that? Okay. Greg, you want to put up the next while we're waiting for Greg to pull that slide up. Any
Should
thoughts?
be up.
No, it still is showing the brain health.
Is it?
Mm-hmm.
That's so weird, because I have it up on mine.
It's a Monday. Well, while you're working on that, I'm open to, since we know that as a team, we all are in agreement with the buckets that we've put together, how would you like to propose going forward? Did you like the idea of working in teams and taking one of those buckets and then drilling down again even further? What makes sense to you?
Yeah.
Lori, I liked working in the teams. I thought that was beneficial. Just adding that extra meeting just with one person, so you really get into each other's head on what they're thinking and then bringing it back to the team. I thought that worked well.
Okay. Thank you. How about the rest of you?
Yeah, I agree. I think it makes a lot of sense. It's easy to work and to plan another time for two people than for a whole group.
Okay. So as we're working on the three documents again, which we will get cleaned up and sent back out to all of you, I might suggest that we just stay in our working teams that we've had, and then you can make a selection as to which of the three buckets. And I'm going to say, I know we have four. We can see if end-of-life care, we want to share that, if we want to just one team take on 2 buckets, however you want to do that, since we're an odd number here. But part of the working homework assignments then would be to really take this proposed document, and again, if you want to change it up, you want to add another layer in there, that makes sense. But I think now we're taking it to the next level of identifying those barriers and then a recommendation of how we overcome them. To your point, Bonnie, again, it's not to say this piece of data or this research tells us to do this. It's more like, for example, if one of the barriers is access, how do we work to overcome the limitations of access? Now, obviously, if we could solve that in 3 tunes or less, we wouldn't have the issues that we have in healthcare. But I think looking at it again at the largest level to be able to then go, okay, what data, what services, what are other states doing? How do we plug the data into that barrier? And then how do we overcome that? So, and certainly then we could take a stab at measure of impact. For example, I could certainly think that a measure of impact on early detection and diagnosis would be able to track the data to show that we're diagnosing people earlier in the disease, we're identifying MCI, I think there would be ways clinically to look at, did our efforts to overcome those barriers have an impact, and are we seeing earlier diagnosis and detection? And again, how we'll be able to measure that, I think, is now for the consultant to be helping support, but at least we're building the framework. Does that make sense?
Yeah, I agree.
Okay.
Now, is it showing on the screen?
It's not. It's still the brain health awareness, but that's okay. I think
That's crazy.
the documents are kind of the same. And
Yeah.
again, clean those up and get them out. Are you all okay with the idea of just staying within your teams, or do you want to break that up and change up your partner?
I love my partner. It's Jen.
I'm fine staying with the same team.
Okay. All right. Very good. Do you have a preference as to which of the buckets you work in, or do you want us to just randomly assign them?
Lori, can you just say the buckets again real quickly so we can
So
make a decision?
the first one that we just relabeled is pre-diagnosis, and that would be the mitigating of risk factors. And that's the one that underneath that we know is talking about brain health and prevention and kind of that upstream care, but in a cleaner diagnosis or cleaner category. And then the second would be early detection, early diagnosis. We haven't played with the verbiage in that, but that would be looking at how do we get people diagnosed earlier in their disease state. And then the third would be innovative interventions. And then the fourth is the long-term care. Not long-term care, end-of-life care. I'm sorry. Let's
Lori,
see.
I don't want to speak for you, but I would be comfortable with number 2. I know you and I are teamed up. Like number 2 would be the most.
The early detection.
Yeah, early detection would probably be the better one for
All
that.
right.
I would.
Greg, what do you think about number 3? Is Greg, you there?
Yeah, I'm on. That's fine.
Okay, unless you want one. I mean, it's up to you.
Nope, number 3 is fine.
Okay.
So by
Jen, what do you think?
Bonnie, number 1, which I think makes good sense given that Jen labeled that bucket. So I think that sounds good. And then end-of-life care, again, we can all maybe take a stab at that. Again, I think it's going to kind of roll into some of this anyways. And we will, Greg, before you send this out, then let's take a close look at the document and we'll clean it up and get it clear based on what we've talked about today. And then each of you as your team will get all 3 of them, well, actually all 4 of them, but you'll only have to work on yours, but you'll have it then in your file.
Okay, perfect.
So we have down then, just for recording, Greg, we have Jen and Bonnie will take bucket number 1, which is the pre-diagnosis. Trey and I will take early diagnosis, and you and Tina will work on the intervention, third bucket, and then the fourth bucket of end-of-life care, everybody will have, and if we want to just all add a few elements to that, we could do that as well.
Got it.
All right, so that's sort of where I'm at. Does anybody else have thoughts, ideas, things that we want to make sure we address in today's meeting?
So I think this was our last meeting set up. Was that correct? Let me look real quick. So the 10th, yeah, we don't, oh no, we do. We have one set up for the 10th currently. So we're okay there.
So maybe we just keep that one for right now and see where we land, because by that time we'll have this document a little tighter.
Yep.
And then we can decide, you know, how frequent or what we need to do as a subcommittee. So, all right, if there's nothing else around this, looks like we can give you back at least 20 minutes of your morning.
Lori, can I just ask, this is Bonnie, would we
Yeah.
make the assumption that the consultant will be on next Monday, or I don't remember the time frame?
You mean will be present in our subcommittee or in
Yeah,
our?
I don't know when, if Tessie, the person that the contract's going to be awarded. Just wondered.
They didn't give a date.
Oh, okay.
They weren't willing to commit to one yet.
Super. Thank you.
All right, anything else from anybody on kind of where we're at in this process?
I'm good.
I don't have anything.
All right. Well, with that, then we'll adjourn the meeting. And we will, you can look for those documents coming in your inbox and kind of your assignments as a team. And then when we get back together during the 10th, we'll have each of the teams report out like we did in the last batch. And hopefully by then we have some clear, workable documents.
Perfect. So Lori and Trey, we should catch up here soon, maybe by tomorrow, just to
Yep.
make sure that the verbiage is right on each one of these.
Yep.
Do you have a few minutes after this? We can log in with a quick Zoom call and knock it out.
Yeah,
Trey,
that works.
you good until?
Yeah, I can make that work.
Okay,
Yep.
perfect. All right, very good. I will. We will see everybody on the 10th.
Thank you.
Thank you.
Thanks, everybody. Have a good